Lewy body dementia, understanding symptoms, causes, and treatment options. Dementia is a debilitating disease that affects millions of people worldwide. One of the lesser-known types of dementia is Lewy body dementia. This disease affects both the brain and body, leading to a range of symptoms that can be difficult to manage. At present, there is no known cure for Lewy body dementia, but there are several treatments that can help manage symptoms and improve quality of life. In this post, we will take a closer look at Lewy body dementia, including its causes, symptoms, and treatment options. We'll also discuss some of the challenges that families and caregivers face when dealing with this disease and offer some tips on how to cope. Whether you're a caregiver or someone who has been diagnosed with Lewy body dementia, this article will provide you with valuable information and resources to help you navigate this difficult disease. 1. What is Lewy body dementia? Lewy body dementia (LBD) is a type of progressive dementia that shares certain characteristics with both Alzheimer's and Parkinson's disease. LBD is caused by the buildup of abnormal proteins in the brain called Lewy bodies. These abnormal proteins affect the brain's ability to function properly, leading to a decline in cognitive function, movement, and behavior. LBD is often difficult to diagnose because its symptoms can be very similar to other types of dementia, and patients can display a wide range of symptoms that can change from day to day or hour to hour. Some of the most common symptoms of LBD include problems with memory and thinking, difficulty with movement and balance, and changes in behavior and mood. Other symptoms may include sleep disturbances, visual hallucinations, and changes in blood pressure and heart rate. Because LBD is a progressive disease, symptoms usually get worse over time and can lead to serious complications like falls, infections, and difficulty swallowing. While there is currently no cure for LBD, there are several treatment options available that can help manage the symptoms of the disease. These may include medications to improve cognitive function and reduce hallucinations, physical therapy to improve movement and balance, and counseling or support groups to help patients and their families cope with the emotional and mental challenges of the disease. It is important to work closely with a healthcare provider who is experienced in treating LBD to develop a treatment plan that is tailored to each patient's individual needs. 2. Understanding the causes of Lewy body dementia. Lewy body dementia (LBD) is a type of dementia that affects a person's ability to think, reason, and remember. It is caused by the buildup of abnormal protein deposits, called Lewy bodies, in the brain. These deposits disrupt the normal functioning of the brain, leading to a range of symptoms. LBD has two forms: dementia with Lewy bodies (DLB) and Parkinson's disease dementia (PDD). In DLB, the person experiences cognitive symptoms before or at the same time as Parkinson's disease (PD) symptoms. In PDD, the person develops PD symptoms first, followed by cognitive impairment. The exact cause of Lewy body dementia is not fully understood, but researchers believe that a combination of genetic and environmental factors may contribute to its development. Studies have shown that people with a family history of LBD may be more likely to develop the condition, indicating a genetic link. Other factors that may increase the risk of developing LBD include age, head injuries, and exposure to toxins. It's important to note that LBD is often misdiagnosed or underdiagnosed because its symptoms can be similar to those of other brain disorders. If you or a loved one are experiencing symptoms of LBD, it's important to seek medical attention and receive a proper diagnosis. Treatment options are available to help manage symptoms and improve quality of life. 3. How Lewy body dementia differs from Alzheimer's disease. While Lewy body dementia (LBD) and Alzheimer's disease share some similarities, they are different conditions. The primary difference between the two is the symptoms that occur in the early stages of the disease. Alzheimer's disease typically begins with memory loss and progresses to cognitive impairment and problems with language, communication, and decision-making. In contrast, LBD usually starts with motor symptoms like tremors, stiffness, and difficulty with walking, followed by cognitive symptoms such as confusion, hallucinations, and sleep disturbances. Another key difference between LBD and Alzheimer's disease is the presence of Lewy bodies in the brain. Lewy bodies are abnormal protein deposits that form in nerve cells and disrupt normal brain function. These deposits are found in the brains of people with both Parkinson's disease and LBD, but they are not typically present in the brains of people with Alzheimer's disease. The treatment for LBD also differs from that of Alzheimer's disease. While there are no cures for either condition, the medications that work well for Alzheimer's disease, such as cholinesterase inhibitors, can sometimes worsen the symptoms of LBD. In some cases, anti-Parkinson's medications may be prescribed to help alleviate the motor symptoms of LBD, but these medications must be carefully monitored to avoid worsening cognitive symptoms. Overall, understanding the differences between LBD and Alzheimer's disease is important for getting an accurate diagnosis and receiving appropriate treatment. If you or a loved one is experiencing symptoms that could be related to LBD or Alzheimer's disease, it's important to speak with a healthcare professional to get an accurate diagnosis and develop a treatment plan. 4. Common symptoms of Lewy body dementia. Lewy body dementia (LBD) is a complex condition that affects the brain's ability to think, move, and regulate bodily functions. The symptoms of LBD can vary, depending on which part of the brain is affected and the stage of the disease. However, there are some common symptoms that people with LBD may experience. One of the most common symptoms of LBD is cognitive decline. This can include problems with memory, attention, problem solving, and language. People with LBD may also experience hallucinations, which can be visual, auditory, or both. These hallucinations can be very vivid and may involve people, animals, or objects that are not there. Another common symptom of LBD is movement problems. People with LBD may experience stiffness, tremors, and difficulty with balance and coordination. These symptoms can often be mistaken for Parkinson's disease, which is another condition that affects movement. Sleep disturbances are also common in people with LBD. They may experience daytime drowsiness, restless leg syndrome, and rapid eye movement (REM) sleep behavior disorder. In this disorder, people act out their dreams while they are asleep, which can lead to injury for them or their bed partner. Other symptoms of LBD can include changes in behavior, mood, and autonomic functions, such as blood pressure and heart rate. If you or a loved one is experiencing any of these symptoms, it is important to seek medical attention promptly. While there is no cure for LBD, there are treatments available that can help manage symptoms and improve quality of life. 5. Early warning signs to watch for. Lewy body dementia (LBD) is a complex disease that affects the brain and cognitive functions of a person, making it difficult for them to carry out daily activities. Understanding the early warning signs of LBD is crucial as it can help in the early detection and management of the disease. Here are some common LBD symptoms to watch for. 1. Cognitive changes. LBD can cause changes in thinking and reasoning abilities, making it difficult for a person to concentrate, remember things, or make decisions. 2. Movement problems. LBD can cause muscle stiffness, tremors, and difficulty in walking, which can be mistaken for Parkinson's disease. 3. Visual hallucinations. People with LBD can experience hallucinations, which can be distressing and confusing for both the person and their caregivers. 4. Fluctuations in alertness. LBD can cause sudden changes in alertness, making a person feel drowsy or confused at certain times of the day. 5. Sleep disturbances. People with LBD can have difficulty sleeping, which can worsen other LBD symptoms. If you notice any of these warning signs, it's important to talk to a doctor who can evaluate the symptoms and provide an accurate diagnosis. Early detection and treatment can help manage the symptoms of LBD and improve the quality of life for both the person with LBD and their caregivers. 6. The role of genetics in Lewy body dementia. Genetics play a significant role in the development of Lewy body dementia (LBD). Studies have shown that individuals who have a family history of LBD are more likely to develop the condition compared to those who do not have a family history. It has been found that mutations in certain genes, such as SNCA, LRRK2, and GBA, may increase an individual's risk of developing LBD. However, it's important to note that not all individuals who have these gene mutations will necessarily develop the condition. In addition to genetic factors, environmental factors may also play a role in the development of LBD. For example, exposure to toxins or traumatic brain injuries may increase an individual's risk of developing LBD. It's important to understand that while genetics may play a role in the development of LBD, it's not the only factor. There are many cases where individuals without a family history of LBD have been diagnosed with the condition. Therefore, it's essential to seek medical attention if you or a loved one are experiencing symptoms associated with LBD, regardless of your family history. It's also important to note that while there is no cure for LBD, there are treatment options available to manage symptoms and improve the quality of life for individuals with the condition. Treatment plans may include medications to manage cognitive and movement symptoms, as well as counseling and support services for both the individual and their family members. 7. Diagnosing Lewy body dementia. Diagnosing Lewy body dementia (LBD) is often a challenge due to the varied and complex symptoms that resemble other neurological conditions like Parkinson's disease or Alzheimer's disease. It's important to get an accurate diagnosis because the treatment for each of these conditions is different. Also, since LBD is a progressive disease, the earlier it is diagnosed, the sooner treatment can begin, and the better the outcome for the patient. Diagnosing LBD typically involves a thorough physical examination, including a review of the patient's medical history and current medications. Often, a specialist like a neurologist or geriatrician will conduct cognitive and neuropsychological testing to evaluate the patient's cognitive abilities, such as memory, language, and problem-solving skills. Brain imaging studies like magnetic resonance imaging (MRI) or computed tomography (CT) may also be used to look for changes in the brain that are associated with LBD. In some cases, a dopamine transporter scan may be performed to look for changes in the brain's dopamine system, which is often affected by LBD. Since LBD is a multi-system disease that affects multiple areas of the brain, other tests may be performed to evaluate the patient's cardiovascular, gastrointestinal, and urinary systems. These tests can help to identify any underlying health conditions that may be contributing to the patient's symptoms. Overall, diagnosing LBD requires a comprehensive evaluation that takes into account the patient's symptoms, medical history, and the results of various tests and assessments. If you or a loved one are experiencing symptoms of LBD, it's important to seek medical attention as soon as possible to begin the diagnostic process and get the appropriate treatment. 8. Treatment options for Lewy body dementia. As of now, there is no cure for Lewy body dementia, but there are certain medications that can help manage the symptoms. These medications work to increase the levels of dopamine in the brain, which can help with the Parkinson's-like symptoms. In addition to medications, there are various therapies that can help manage the symptoms of Lewy body dementia. Physical therapy can help with movement and balance, while occupational therapy can help with daily tasks such as dressing and eating. Speech therapy can be beneficial for those with Lewy body dementia who may experience difficulty with speaking or swallowing. Additionally, counseling and support groups can be helpful for both the individual with the disease and their caregivers, providing emotional support and guidance on how to manage the disease. It's important to note that treatment options for Lewy body dementia can vary from person to person, and it's important to work with a healthcare provider to determine the best course of action for each individual case. While there is no cure for Lewy body dementia, proper management of the symptoms can greatly improve quality of life for both the individual with the disease and their loved ones. 9. Medications and therapies that can help. While there is no cure for Lewy body dementia, there are medications and therapies that can help manage the symptoms and improve the quality of life for those living with the condition. One of the most commonly prescribed medications for Lewy body dementia is cholinesterase inhibitors, which can help improve cognitive and behavioral symptoms. Another medication that may be used is a dopamine agonist, which can help manage the movement-related symptoms of the condition. In addition to medications, there are also several therapies that may be recommended for those with Lewy body dementia. Occupational therapy can help individuals with the condition maintain their independence and continue to perform everyday activities. Physical therapy can help manage movement-related symptoms, while speech therapy can help with communication difficulties. It's important to note that medication and therapy options may vary depending on the individual and the severity of their symptoms. A healthcare provider will work with the individual and their loved ones to develop a personalized treatment plan that meets their specific needs. It's also important for individuals with Lewy body dementia to have regular checkups and evaluations to ensure their treatment plan is effective and adjusted as necessary. 10. Coping with Lewy body dementia, tips for patients and caregivers. Coping with Lewy body dementia can be a challenging experience for both patients and caregivers. Patients may experience a range of symptoms that can affect their physical, mental, and emotional well-being, while caregivers may find themselves struggling to provide the necessary care and support. However, there are several tips that can help patients and caregivers cope with Lewy body dementia. Firstly, it's important to establish a routine and stick to it. This can help patients feel more secure and comfortable as they know what to expect each day. It's also important to create a peaceful and calming environment that is free from distractions, as this can help reduce the risk of agitation and confusion. Secondly, it's vital to stay engaged in activities that promote mental and physical stimulation. This can include things like puzzles, games, and exercise. It's also important to maintain social connections with family and friends, even if it's just through phone or video calls. Thirdly, it's important for caregivers to take care of their own physical and emotional well-being. This can include getting enough rest, seeking support from others, and taking breaks when needed. Caregivers should also make sure they have access to resources and support services that can assist them in their caregiving role. Lastly, it's important to stay informed about the latest research, treatment options, and support services that are available for Lewy body dementia. This can help patients and caregivers make informed decisions about their care and treatment options. With the right support and resources, patients and caregivers can effectively manage the symptoms of Lewy body dementia and maintain a good quality of life. We hope that our article on Lewy body dementia has been helpful in understanding the symptoms, causes, and treatment options available for this condition. Dementia can be a difficult diagnosis to navigate, but we hope that our guide can provide some clarity and understanding for those who are dealing with it. It's important to remember that every individual's experience with dementia is unique, and there is no one-size-fits-all approach to treatment. However, with proper care and support, those living with Lewy body dementia can maintain a good quality of life for as long as possible. Thank you for reading and sharing this important information with others who may need it.